Okay, well, I think we're just going to get started then. Thank you, Dr. Dormush, for being present today. I don't know if you have other people with you on this call. If you do, please feel free to put in the chat to let me know how many people are with you. But so let's get started then on this Micromedex academic package that you've got now at your facility. So my name is Fabian Wecker. I am I'm the person in charge of the clinical education here at Micromedex on the international level. And what we're going to do today is to get into the depth of the Micromedex academic package subscription that you have now. So I do understand, and Anton, if you can confirm to me that this is the upgrade to the academic package just happened over the past month, but people had used Micromedex before, correct?
Yes, they had Micromedex and they have academic package.
Very good. Fantastic. So Micromedex in and of itself is a clinical solution that has been recognized this year again by CLAS as the best solution for point of care, for care delivered at the point of care. And CLAS is an international, is an American group of people who looks at different clinical solutions all over the world and tries to determine, after talking to clinicians and end users, whether the solution, like in this case Micromedex, is favored, or if there are any issues, or what seems to be going on. And when it comes to all information pertaining to drugs, Micromedex has been voted the best one at the point of care by clinicians themselves. So after over 50 years on the market, Micromedex is still recognized for its robust clinical evidence and the way it presents the information. Within Micromedex, this is the homepage you've got right here. You have the homepage where you can find some quick links to further information that you want. Many of those will be drug consoles, like extravasation is part of the drug consoles, which we will be discussing as well very briefly owing the time. But I'll be discussing all of those different aspects. Then we have drug interactions, self-explanatory, IV compatibility, drug ID. We're not going to be spending much time on this just because this is pertaining to only North American drugs. So if you're working with a North American patient, this is something you can use, and there shouldn't be a problem to identify drugs on the market. But any other patient or any other query that does not pertain to the North American market, this is something that we'll leave on the side. Then we have drug comparison, which allows you to check two drugs side by side. And this gives you the overview of the monographs as they appear in the summary documents, right? So it's the synthesis of all the detailed monographs that you'll be able to see side by side. Care notes is basically to the patient what Micromedex is to the clinicians. So care notes is patient education. Then we'll be talking about that too. We have neofax in pediatrics for neonates and underage population. Toxin drug product lookup is something else you'll have access to with the toxicology. Red Book is something that will be part of your subscription as well. Calculators and of course formulary. If you want to see further information, you can actually just scroll down here, and there you will have the Micromedex solutions. So by clicking here, you can see more information about Micromedex. You can see the perspective about how to contact us, how to cite Micromedex. So when you cite Micromedex, you click on it, and this is the document that comes up. So you can see very easily how to reference it based on the Micromedex system, based on the specific module, or if you go down based on an individual document. So for instance, if you're looking something up on the Bigatran, you would just go to Merative Micromedex Drug Dex, add the Bigatran right here, copy and paste this as is, and then add the month, day, and year. So this is the way to officially refer to or reference Micromedex. Under support, you can click here and you have different features, among others, training center. In the training center, you have, let me make this a bit bigger. There we go. In the training center, you do have the various functions here to view the optimal aspects pertaining to the use of Micromedex by nurses, pharmacists, and physicians. So all you have is to click right here, and then you get within this page additional little tips and tricks and the resources, among others, with videos and Micromedex tools and applications right there. All you have to do is to expand it and then watch a short video. All the videos are anywhere between 4 and 8 minutes long to promote an additional quick overview. And then we've got latest news that will be found here when there are any available. And then you will be able to see a comprehensive approach to Micromedex. From the main search field right here, this is where the actual usage of everything you've got in Micromedex starts. So let's start with a drug. Let's just use a basic drug that we can promote with regards to what we have. Because time is a little bit more limited, I'm just going to use something that is much more general and straightforward, and then we'll go into the details of what we need. So from here, let me use a drug like simvastatin. So I start typing the drug and I see it's in bold. So within the word wheel, when the drug that you have is listed in bold characters, that means that it's been recognized, right? So you can go just to simvastatin or go directly to dosing or indications part or sections of the monograph. Otherwise, as you go down, you see other hits pertaining to simvastatin that can also be helpful, including any combinations on the market with simvastatin, in this case, ezetimibe, or fenofibrate, or niacin, and so on and so forth. But let's go with simvastatin. We launch the simvastatin page and we get straight to the monograph. On the monograph, you will see on top, as you have the academic package, the F, and F means this is something that is seen on the formulary. Of course, right here, I do have the training playground, but you will have this as well once you click on it. Here we have different, different features about different formularies that have been integrated, and you can see all that. So like this is on the formulary, this is actually accepted. Then if I go to the outpatient patient care, I see this. If you see this, you just click on the logo. Once it gets to the logo and you scroll down a little bit, it will give you lots of different information, among others, the key to the status of the drug. So there's high availability, restricted, formulary preferred, chemo drug, and so on and so forth. And so that allows you as well to see the relative cost that your facility is paying. And of course, this is, again, as a reminder, being on the training playground, this is what you have, those specifics would be specific to your facility once you read into it. And then you can see anything here on the formulary that would also be associated with that. You can see a drug summary that will be found here about what the drug's about, and then any related substances that would be found, right? Other related drug results will be found here too. You can go by search, you can go by therapeutic classes, you can go by pharmacy information. So all of this is information that is populated by people at your facility to reflect what is on the formulary. So then you have drug classes that will be showing for every drug that you have. So you see them in alphabetical order. If there's something you want to see in the drug classes, all you have to do is to click on it. And then when you click on it, you see all the other drugs, in this case, 341 that are found under the drug class cardiovascular agent. So that's what you've got right there. Now, you also have a difference on every monograph between quick answers and in-depth answers that will always be included. The table of contents in and of itself to the left remains the same. So dosing, administration, everything pertaining to this. Then medication safety, mechanism of action, pharmacokinetics, patient education, So this patient education is a bit different from the care notes, which is the module that's specific to patient education. Care notes includes information in depth about drugs, diseases, and so on and so forth. Whereas medication counseling right here, if I click on it, it actually promotes the talking points that are associated with the drug you're looking up. So here for simvastatin, instruct patient to report symptoms of liver injury. And of course, we would tell them what liver injury would be. So this is not something we give to them. It's something that promotes how we approach the patient education whilst the patient is in our care, right? Letting them know that side effects may include constipation, nausea, abdominal pain, insomnia, dizziness or vertigo, upper respiratory infections. So these are talking points to promote the people at the point of care, like pharmacists, physicians, nurses, to actually provide education to the patient, right? And then I'll show you what the care notes is like afterwards. Then we'll talk about toxicology. So there is a full monograph, detailed monograph on toxicology, but here you have the summarized version of toxicology, including clinical effects, range of toxicity, and treatment that you would need. So if I click here, for instance, you can see under treatment, in case of toxic levels of simvastatin in the blood, you have supportive care, you have patient disposition, including if they're at home, if they're called in, for instance, for the emergency services, observation criteria, if they are in the emergency room, admission criteria, if they need to be admitted to the hospital, and then consult criteria once they are in the hospital. Then the same with decontamination. That's pre-hospital stages and the stage and the hospital stage. Airway management, antidote. Then we have something specific about rhabdomyolysis, and then monitoring of the patient and the enhanced elimination procedure. And then we have the about section that actually shows everything that doesn't quite fit into any of the sections above. Among others, storage and stability, that will be found right here. And the storage and stability, you will have all these features here about those specific aspects, pertaining to the drug you're looking up, in this case, simvastatin, as you can see right here. Then if I go further down, you see miscellaneous information right here. As needed, within this storage and stability, you will also have information about extemporaneous solutions, right? And then to the right, we have related results. So you have alternative medicine, disease, toxicology. You have drug consoles that will be there as well, and the product lookup for Red Book and toxin drug. Okay, so here product lookup is that if you are on this monograph and you want to look something up in Red Book, which is also what you have right here, which is a pricing tool from Red Book, you click on it. I see simvastatin, and it allows me to jump straight to what you have right here. There you have, if there's been any price change in the past 30 days, you'll have a little gold star, which we don't have anything here pertaining to simvastatin. So that means that price has not been affected in the past 30 days. You have the product name specific to what's going on. Active ingredient, in this case, simvastatin. But if it were like a combination drug with ezetimibe, you would be able to see that right here as well. You have information about the manufacturer, if there's any repackaging, generic, Orange Book code, So this one is basically the code that's used by systems like CMS, Medicare and Medicaid services. You have the code type, identifier, form, strength, route, package size, unit dose. In this case, if I click this one, it's simvastatin from Accord Healthcare, and then it's the WAC price per package is $82. The AWP average wholesale price package is $4,917, and then the AWP per unit price comes down to $4.91, and so on and so forth. Now, this might be especially useful if you're working with those financial aspects, but otherwise it's just part of the academic package that you've got right here. Now, if we come back to the main section here for simvastatin, I can look up dosing and for adults and pediatrics, either in the quick answers, and in the quick answers, this is basically how you will see the information. So for instance, general dosing information, and you have then the alphabetical order of the different conditions that simvastatin is used for, right? So if I'm looking at this and I'm like, okay, I want to see information about hyperlipidemia primary, I click on it, and then I see my information right there. Basic, straight to the point. This is what's useful if you just want to have the general information regarding simvastatin in this case to promote actual use straight to the going straight to the to engage straight with the patient there, right? As opposed to the same information in in-depth answers. So if I'm going down here now and I click on the hyperlipidemia primary, you see tablets, you see suspension. So it gives you a little bit more information there. So dosing is going to be included for adults and pediatrics. You also have dose adjustments. So under the dose adjustment, again, you have quick answers that will be found right here. So there it's fairly succinct. But then if I want to get more information about the kidney functions or renal functions, you click on it and it will provide additional information there. I can expand everything, and then you see other dose adjustments based on weight, on age, and so on and so forth. Okay, and that's the case for both adults and pediatrics. Then we have the indications. So FDA indications, it's a bit, FDA uses here is a bit of a misnomer, because FDA uses really means like primary indications, generally speaking, and then non-FDA uses would be the off-label uses, right? So all this you will have right here. You can see right now I'm on quick answers. If you want to go to quick answer, in-depth answers, if you want to go to quick answers, all you have to do is click on this and it keeps you on the quick answers right there. Okay, so it makes this a little bit easier to go back and forth. Now, one thing is that if you decide to click here on quick answers, you can get there as well. Okay, so it's whichever works best for you or whatever you are most comfortable with. So that's the nice thing about Micromedex, is that it's not always prescriptive that way. So it's what the best way to use it is the way that works best for you. So there, if I see hyperlipidemia primary, you can click on any here, but if I pick this one to continue with the gist, what you will have is see an overview. Has it been approved for adults? Yes, not for pediatrics, but in adults, the use is effective based on the research. Pediatrics, however, evidence favors efficacy, although it has not been put on the market specifically for that targeted population. It has been used over time, and in pediatric, evidence favors efficacy. It shows a class 2A for both adults and pediatrics, and strength of evidence category A for adults, category B for pediatric. If you're not sure what those mean, you always have like a little key right here, like the drug console. You click on it, and then it tells you what the difference is between category A and B, as you can find right here. So it's like the pyramid that you have. A is at the top, B, and then C. So this is how we proceed from the perspective of the evidence right there. Then you can see information about off-label information, so works the very same way. So in the quick answers, if I'm looking for off-label indications, you see coronary atherosclerosis, stable. You have the info button. You can click this, and it shows that it was not put on the market for this specifically, but in adults, it proves to be effective. So simvastatin for the treatment of coronary atherosclerosis, that's stable, shows adult class 2A, that's the recommendation, and evidence category B. Now, if I want to see this again in the in-depth answers, it's all the same process. I'm right here, coronary atherosclerosis, stable, and I see further details right here, including summarization or the synthesis of the different guidelines. You have a European Society of Cardiology guideline as well, and you can see it's always fully referenced. If you want to see where the reference comes from, you can click on it and you can see the information from the guideline right here that you have access to through PubMed. If I go on, you have administration. Again, in-depth answers shows you more details, whereas the quick answers in that same section just gives you bullet points to help the people at the point of care work faster. Something we are the only ones on the market having is comparative efficacy. Within the comparative efficacy, you have all the different drugs that have been used instead of simvastatin, and that can be either because the patient didn't tolerate simvastatin that well, or because there's a shortage of simvastatin, or any other reason where simvastatin would not necessarily be recommended or available. So what you do here is actually have a list of different drugs in alphabetical order that promotes, drugs, or in this case, diet education, to potentially help if someone is in a situation where being treated with a drug could be avoided, what can be done. You have other drugs from different drug classes like enalapril, for instance, that can be used. If you have an ACE inhibitor as opposed to others, you have combination drugs. And so all you have to do there is potentially see, simvastatin. If I see simvastatin and I look at the fish oil, how do the two in actually empirical data show efficacy, right? So fish oil for hyperlipidemia, if I go down, and it shows it was a small study of patients with high cholesterol after kidney transplantation, that simvastatin and fish oil produced reductions in lipids, which were not statistically different between treatments. And from there, you can see the information, you can click on the link, and this is the study, right? It's a study that goes back to 1997. Now, sometimes in what you see, the editorial process is that if there is a study that was started out and that is basic, that hasn't been where the information that was provided is still valid, it will always be there, right? Our monographs are reviewed and revised up to daily, and I say up to daily because if there's nothing new, we're not going to update or make something up, right? But all the features within the monograph are always updated regularly. And to see when a drug was last updated or when a drug page was last updated, you go all the way down, you click on the references, and they are available in both quick answers and in-depth answers. And then you scroll all the way down and you see when this was last updated. So this goes back to January 28th, 2026. Okay. But if something new were to be embedded within the monograph or added today, then that would default to the time today. So this is how all this then works within Micromedex. Medication safety, this is where you have contraindications, precautions, adverse effects. Again, works the same way for every one of those, right? So adverse effects, this is in the in-depth answers. If I want to see the same information in the quick answers, this is how you actually see the information. So sometimes when we look at quick answers, it seems quick answers is a bit too generic and in-depth answers is what we want. Something here, and this is a good example, is that in the quick answers, you have everything at a glance that you can see. So this is something that could work great for somebody who's not as experienced, or a nurse, or anyone who just at one glance wants to see whether the adverse effect would be a common adverse effect, something that we would expect with the treatment on this drug, or that it would be more serious. So, okay, something that needs to be reported. Whereas in the in-depth answers, it's not split under common and serious. It's just another take. It puts everything in alphabetical order. And if I expand everything, you see all the details right there. But again, it's not in order of prevalence like common or serious. It's going to be in a textual format, as you can see right there. Again, every time with fully references pertaining to this drug. And to the same extent, we have box warnings. So these are the box warnings from the FDA. You have REMS. REMS stands for Risk Evaluation and Mitigation Strategies. So that's if one is actually available. So here, those are not available. There's no REMS for this one. So that's why it's a blank. And then you have drug interactions. So the drug interactions, again, here, you have everything in alphabetical order pertaining to every drug. So if I take simvastatin and you look it up with amiodarone, there is a drug interaction which shows that increased exposure to simvastatin with amiodarone an increased risk of myopathy or rhabdomyolysis might actually be the outcome of this interaction. You have the summary, severity, onset, substantiation, and then clinical management that will show right here. Okay, what do you do when this happens? You have the mechanism, and then the literature reports based on this interaction that is going to be used there based on different cases. So this is how this shows right here. But now, and this one was with amiodarone here, right? Now, when I come back up and I decide to go to the quick answers, in the quick answers, right now, you don't have any information there because we are updating the information. But the way to go about that is that when you go right here, drug interactions that has been created, you click on it, and from here you can actually make it much more specific, right? So simvastatin, and I'm going to put amiodarone just to show you the information. I can type in, let's say, if they are also on potassium chloride, and let's say we give them some augmentin, and let's say they're on a heparin flush. So you can put in any drugs that you would want to have right there, that pertain to the patient. And you can also add something like, for instance, ginger as an alternative medicine, or St. John's wort. So you can put in around 100 drugs that you can put in there, right? As you put them in, they're listed in alphabetical order. You can also add allergies here. So let's say the patient is allergic to penicillin, and let's say the patient also has an allergy to peanuts. You just type it in, you select it, and then you update. And now I've got my drugs, my list of drugs, and the allergies. And I know that penicillin here is an allergy because it is capitalized with an asterisk. And when it's capitalized with an asterisk, that always indicates an allergy. And now I can take all those drugs listed right there and I can submit. And when I submit, you can see all the information right here listed in order in the table in order of severity. Notice that you have drug to drug, 6 drug interactions, that interacts among the list of drugs that we have right there. Okay, so I clicked here. You do have, let's go cancel here. Then there are no ingredient duplications. So this, for instance, is if I went to type in the combination drug simvastatin and ezetimibe, because I already have simvastatin that's listed in the drugs in there. You also have drug allergies. So here we have the augmentin, because we have the allergy to penicillin. We have drug food interactions that will be found right here. And so it's always listed in order of severity, from most severe or contraindicated to least severe. So it goes contraindicated, major, moderate, minor, right? And it tells you what this really means. Then you have the documentation. It goes from excellent to good to fair, and it tells you what this all means. And then the summary, basic summary. For instance, amiodarone grapefruit juice results in increased amiodarone exposure. So that's why you want to avoid this. But this is great, for instance, if a nurse calls, so we just let them know, no, we don't give amiodarone because amiodarone, we don't allow patients to have grapefruit juice because it actually increases amiodarone exposure. But if you are a physician, pharmacist, or advanced practitioner, you may want to have a little bit more information. So that's when you click here, and the same results we had in the detailed document will also show here: clinical management, onset, severity, documentation, mechanism, summary, and literature that you find right here. Okay, and this works for all of them. Drug to lab interactions, any interaction with alcohol, tobacco, pregnancy, lactation will also show right here. And all of this is going to be fully summarized right on top. The same works with IV compatibility. So here you will click on this. If I were on the monograph itself, I can see the IV compatibility, right here. So you go from click on single, and it takes you directly here, selecting automatically the drug that you come from. So simvastatin is, in this case, doesn't work because it's a PO drug, but that's why it doesn't show any matching entry, right? So it will always take you there, and then you decide whether this is the case or not. Now, sometimes there are some drugs, like for instance, warfarin, which is given PO in the States, and there is no suspension or infusion of warfarin. But in Europe, you can find this, right? So in this case, it always will reroute you through here to be able to put it in. But if the drug does not have an IV formulation, then it will just show what just happened here with simvastatin, right? So I wanted to show this example to show you an example where you might feel, why does it take me there? Well, it will always automatically take you to the IV compatibility to see the section with the Driscoll's tables. And that's where you are aware of how that would work. But if I'm going here and I want to have something like, let's say, potassium chloride, and I use some phenytoin, and let's use some insulin, and maybe some vancomycin again. I use this, I use those four, and I now check compatibility. Now you have popular drug pair searches that will be found here. I think there are as many as 15 or 20. You know, if I show more, you can see all of them here. And those are the ones that are most frequently searched by Micromedex users. But if anything here, if there's just two drugs you want to see, that can be easy, but we're just going to make it as easy by putting in the 4 infusions that we have. You view compatibility, and now you can see everything in the Driscoll's table, in the table right here, or you can put them in the list by pairs. Okay, so whatever you prefer. And then once you go there, you can see that insulin and phenytoin is incompatible, but potassium chloride is compatible right there. Okay, so this is how you can go around this, and all you have to do is click on it, and then you can expand all and see the different studies based on those Driscoll's tables. Okay, so it will come back down to units or concentration as well as manufacturer, and that's how you have the information. Sometimes something might be, you have results that might be differing, or there might be a variability in results, and that then you will have a little triangle that will also be shown to tell you, okay, watch out, there is a difference in interpretation when it comes to compatibility that can differ based on concentration, right? Filter results, it always gets filtered with Y-site directly. You can do admixture if you want to, and syringe if you want to add this by just applying the filters, and then it will show there. But admixture and syringe is a little bit less frequent, so that's why it just defaults to the Y-site. Okay. If you want to filter everything by uncertain or no data, you can do that here too. Along with that, if you're familiar with the Handbook of Injectable Drugs, you've got information right here. So this is behind those links. You've got those pages that are highlighted. I click on vancomycin, and then you see the full information right there from the Handbook of Injectable Drugs. So you have the full monographs that will be found here as well. It's a little bit hidden, so you don't always see very quickly what this is all about, but that's what you've got right there. And so you can see it's fairly long with the comprehensive feature with all the different studies, and then of course the reference section always at the very end. If you don't want to scroll up and down, to get back to the top of the page, I click here, and then it takes me directly there. And this works within the IV compatibility for drug to drug, drug to solutions that you've got right here, and then TPN that you have here as well. So this would be for the nitty-gritty perspective of how the drugs would work. Drug ID, again, only for North American drugs that identifies the pills, but this one is, again, not for main consumption, I would say, based on, anyone outside of the US and Canada. And then you have drug comparison. So there, for instance, I may want to look at a comparison between simvastatin and atorvastatin. So I've got the two, and let's use atorvastatin in this case, and I can do a side-by-side comparison of those two drugs based on the monographs. So if I wanted to check the adverse effects, I can see at one glance, the adverse effects split between common and serious, between atorvastatin and simvastatin right here. right? I can also look up mechanism of action of pharmacokinetics. I can look up on clinical teaching, that will be found right here as well. And so I'm looking at all those, I can see that I can just see the differences there. So let's say if, with regards to all of this, I'm looking at that and I'm like, yeah, I still want to stick with simvastatin. All you have to do is use this link and it takes you straight to that simvastatin monograph right here. Now, to the right-hand side, where you have the related results, by clicking on alternative medicine, I can see links of simvastatin as it pertains to alternative medicine. And I can see here that simvastatin interacts with niacin. I can click on this, and what it will do is that it takes me to the niacin page, and from there I can see in-depth for drug interactions, and atorvastatin, simvastatin, all those will actually show here in alphabetical order. Things when it comes to the alternative medicine monographs also includes quick answers with a different table of contents because that's pertaining to the alternative medicine, and in-depth answers. In the in-depth answers, you have all that information right here, again, in more details. If I'm looking at simvastatin, it will show the information there, summary, adverse effects, clinical management, and just like you would have it on the main tool that we used before for drug interactions there. What you will also see here is that the main information is that it shows an overview of niacin, dosing information, so the forms, availability, and dosage for adults and pediatrics. It has information on pharmacokinetics that you can have here, again, in-depth and quick answers, and then clinical applications like monitoring parameters, place in therapy, therapeutic uses, that you will have right there. So this is how that information will show right here. And then, of course, comparative efficacy again. And in comparative efficacy, you see niacin with all those other drugs, to show any data that has been published based on the studies out there. Okay, so here, for instance, you see a study that focused on niacin as it pertains to the efficacy compared with lovastatin. And lovastatin was found to be superior to stepped care cholesterol lowering therapy in lowering total cholesterol and low density lipoprotein. And here you have a synthesis of the study that was focused on high cholesterol. Now, from there, I can also go back here and actually come back to drugs or toxicology or diseases, whatever pertains to the drug niacin, right? So if I click on disease, I can, for instance, look up hyperlipidemia, dyslipidemia. I click on this, and it actually provides information pertaining to this condition, hyperlipidemia, dyslipidemia, right? So you have the quick answers that shows here, giving you a definition, medical history, which is the etiology in order of clinical relevance, findings, you have differential diagnosis of hyperlipidemia, you have testing associated with hyperlipidemia, and then treatment, among others, drug therapy. And here we will be able to see atorvastatin. We'll see all those statins, including simvastatin. But here it's all listed in order of based on the regular therapy, and you have procedural therapy, diet education, and non-procedural therapy. What can people do on their own to render them more accountable? Ongoing assessment needed for hyperlipidemia, and then the references will be found right there. Now, along with that, you can also go to in-depth answers, and there you have a table of contents that's slightly altered, but it basically follows the process that the patient goes through, okay? Patient comes in, I have a definition of what hyperlipidemia is, epidemiology, etiology, complications. So patient comes in, I do a test, HNP, I do a basic assessment of the patient. I run some tests to confirm a diagnosis, and then I further assess to figure out whether the patient needs to be admitted to the hospital or if the patient can be released after the ER visit. And then we have a general section on treatment. Treatment summary of hyperlipidemia, drug therapy based on main classes of drugs that will be shown right here. Okay. Then you have procedural therapy and non-procedural therapy. We have a prognosis section, and then any other related information that doesn't quite fit into the conditions up above. And from there, I can still click on drugs, and then I can see, here, for instance, niacin, because that's where I came from. Okay. But generally speaking, if I'm here and I'm looking at the, drug therapy, whether I am in the in-depth or the quick answers, for drug therapy, I see my information right there. I see the different drugs here that are being linked up. And if I wanted to go back to simvastatin, all I have to do is click on simvastatin again. And then that takes me back to the information there. Okay. So from there, I mentioned those drug consoles before. The drug consoles are basically detailed evidence-based documents that actually highlight a particular feature pertaining to the drug you're looking up, in this case, simvastatin. And there, for instance, you have a class comparison of statins. You also have information about drug interactions and other aspects that are pertaining to the drug simvastatin, but that might be, for instance, a little extension of what you would expect to see in a drug monograph. So there, for instance, class comparison of statins, it shows you really what what's sold here, a class comparison of the different statins. So you have approved indications. Again, this is a bit of a misnomer. FDA approved indications means main indications, or why was the drug put on the market in the first place? Okay, well, atorvastatin was put on the market for high cholesterol, high triglycerides, and whatnot. So it shows administration, metabolism, selected drug interactions, and if any dose adjustment is needed. So it presents the information in a different format to actually help you make a decision based on the synthesis of the information shown here. And then you also have at the bottom, statin therapy that will show right here with high, moderate, or low intensity. And all this shows like equivalence right here. So I highly recommend, if you are not, if you've not delved into the drug consoles, every time you get onto a drug monograph, click on it, even if it's only 10, 15 seconds, to just peruse and look a little bit what's out there. It's all listed in alphabetical order, and so that can make it a little bit easier. You'll also notice things like start and stop criteria that can be associated here, and so you have that information there as well. So this was a very general overview of what you have here with the monographs and the drug information there. When I go to Care Notes opens up in a new tab, because it's a little bit different. This one is just focused on the patient, right? So if I were to look up simvastatin, I can click on simvastatin, I click on search, and I see simvastatin oral. And if I just want the information about this, you can see different languages, including Turkish. So I click on drug note. I can do the thing in, click it up on the Turkish, and then you have the information directly in Turkish right there when it comes to simvastatin, basically telling you what it's for, what are other names that it's known as, how do you use this, when should you stop using it, when should you warn the doctor, and so on and so forth. And this can all be changed and amended. There's an administrator tool that actually allows an administrator to go in and actually change what doesn't apply, like here, the 1-800-FDA. The reason why this is here as well is that this is just the document as is, but all this can actually be tailored to the patient. And then you can always print this off, you can customize, you can add to the print list, and, as needed. What I can also do is, in the keyword search, I can look up, for instance, hypercholesterolemia, right? So hyperlipidemia, high cholesterol and whatnot, lipid profile, low fat diet. You have some information there, and I can go to the general information on discharge care that patient might need. I can click, on English. For the drugs, you have as many as 15 different languages. For all other aspects, it's in either English or Spanish. But this, you can also go in and translate that if you need to, right? And take out those things like local emergency numbers or whatnot, make it your own. And you can go down and have the information right here about what's needed and how to explain hyperlipidemia or hypercholesterolemia to people. right? So this is what the care notes here is about. Then we have neofax and peds, which works very much the same as what we had with the monographs. I can go right here, and I, for instance, can look up something like acyclovir, and that works for both neonates and pediatrics. I click on acyclovir, and then you will see both aspects right here. Within the drug information, you have sections of dosing and administration found right there. You have medication safety, for instance, adverse effects that will work just the same way as anything else we've just shown in Micromedex. You have solution compatibility that will be listed here. You have monitoring aspects that will be listed here. So all of this will be found right here, follows the same process as all the other drug searches you can look up as we did in Micromedex. So this is something that can make this a little bit meaningful there as well. You can switch between neonates and pediatrics. So for instance, if I use uses, for neonates, it's for HSV, neonatal HSV infection. That's why, we will have it here. And varicella zoster virus infections with CNS and pulmonary involvement. With pediatrics, it will change slowly. Prophylaxis of, HSV, you have chronic suppressive therapy after treatment of neonatal HSV. So it's a little bit more specific, genital herpes, prophylactic treatment of HSV. So it makes it more specific to what you're looking for. Okay. You can view the full document, you can print as you wish. And when you print, it allows you to print only the sections you want to make it a little bit easier. If you click on the overarching sections, that includes all the other subsets, everything will be listed. And then, you can just determine what you want and so on and so forth. But the benefit here of everything there, of course, you've got enteral formulas for neonates, although many of those formulations will be more specific to the American market, but where it becomes very handy is the dosing calculator. On the dosing calculator, I can type in here, let's say a baby was born on the 2nd of February, population type, we say pediatric, but as soon as you click on something else, it will recognize that this is a baby. So you can put, for instance, gestational age, let's say 32 weeks of pregnancy, and let's say the baby weighed 2.1 kilos. I can now proceed to the calculator, and on the calculator, I can use any of those, any of this information right there. So if I wanted to use Activase, I can click on Activase, and now it tells me, what would you like, Activase, Alteplase, saying what is it exactly you want to use this drug for. Restore central venous catheter function or thrombolysis. So whichever you use, we see IV that will be shown because that's how it's going to be given. And let's say we use thrombolysis. You've got the drug route. You have the summary information here for the patient. You have calculator notes. And as we go down a little bit more, you can see the concentration, you see the rate, So I don't know much about, I'm mostly in cardiology. I don't do much with neonates or that population, but let's say I'm going here and I will decide to, this is missing. What it will do is that if I click on calculate, it will actually calculate this for you, which is actually a nice way of going about it. Based on the compound, if it's 10 milliliter syringe or 30 milliliter syringe, you will see it will change the maximum infusion and whatever's there. Sterile water for injection and Alteplase 1 milligram total volume. And so again, based on the syringe, it will change what's needed here. And it tells you what needs to be reconstituted and so on and so forth. If from here, you want to look up the drug monograph for Alteplase, you click on it and it will open up in a new module, so in a new tab, so you don't lose what you just did, and it gives you information about Alteplase pertaining to the monograph. Okay. Then we have toxin drug product lookup. So again, this is where you will put in a substance, and let's say if I'm typing in simvastatin, and you want to see regarding simvastatin, what is the toxicology monograph, you click on it, and it actually takes you here to lovastatin and related agents in Poison-Dex. Meditex would be more about medical management. So whichever you pick, it's going to give you information there. So I click on there. If your statin reaches a threshold of toxic levels, this is the document you would go to. So you have an overview, which is the same overview as what you would have in your drug, treatment overview, which I showed before. You have substances included and synonyms. And then you have the full in-depth information about summary of exposure when it comes to clinical effects, any issues on head, eyes, ears, nose, throat, or cardiovascular side effects, or neurologic side effects. You can go through all this and find the information. You have monitoring parameters that are needed when it comes to lovastatin, and then you have the treatment. For instance, patient disposition. How do we go about this when the patient is actually in the hospital? Is the patient admitted, or did it happen at home? All this will be shown right there. You've got the range of toxicity. You have information about pharmacokinetics shown right here, ADMEs and elimination half-life, pharmacology, toxicology shown here, and physical chemical features. All you have to do is click on it, and then you get the full information right there. And like everything else, if you wanted to see the medical management, within Poisindex or the index for toxic levels, you click on this, lovastatin and related drugs. It shows the same document, but this time with a slightly different texture to the document, but it still shows the overview, substances, clinical effects, but this time it's mostly based on from the perspective of the medical management. So to help evaluate and treat acute exposures that you have right there. If you want to come back, all you have to do is come back here. And then from there, if you want to go to a drug again, you see all the drugs that are actually associated with this document of lovastatin and related agents. You click on it and you see the related topics right here. Okay. And you always see, the related topics as it pertains to the monograph, treated by, drug consoles, and so on and so forth. And calculators shows you a plethora of calculators, 767 calculators found right here. If I wanted to see anything pertaining to a specific drug or condition, all I have to do is, for instance, type it here. Like if I wanted to see the Cockcroft and Gold creatinine clearance estimate by Cockcroft and Gold, I just start typing in a few letters. I get to the information right there, and there I can just put in, sex is female. Let's say the patient is 45 years old, creatinine of 2.3, and she weighs, let's say, 67 kilos. When everything is filled out, you have the information right there. Further down, you have notes, equations that are used, and then, as everything else in Micromedex, we have full references for the monograph. So many calculators found here, like I said, 767. You can go by specialties. You can go, there's a math calculator. All of those things are there for your pleasure. Formulary, we talked about it before, but this is, generally speaking, the overview of everything you have within Micromedex. We are at the top of the hour. I know there's been a lot. If there's any questions or anything, please feel free to ask. Unmute yourself and ask. Waiting for, let me stop sharing here, waiting for questions to come up. I just wanted to share with you as well a very, very basic evaluation that you can do, that you can fill out if you wanted to. Just, use your phone, take a snapshot of this, and it's going to lead you to a very quick evaluation of what you thought about this, and asking questions and seeing what we can how we can help you otherwise. But yes, this is the extent of the academic package. So again, I know it's been a lot, but that's why we also I've also recorded this, and to make things a little bit easier. And let me copy this in the chat so you can have access to it. But yeah, any questions, comments, concerns?
It looks like there are no questions. So thank you, Fabian. Appreciate your time and help with this presentation.
Very good. Well, thank you, Anton, and thank you everyone at Ege University. Let me stop the recording. I'm going to format this and then send it over.